Prime Minister Dr. Lote Shering, who is an experienced surgeon. Prime Minister Shering, we are all keen to hear you. Please.
Thank you, Your Excellency. Before I start, I would like to take this opportunity to convey my King's greetings to all the heads of the states and heads of the governments here. As we speak, my King is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my King's greetings and greetings of all of us to Prime Minister Oli for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for our father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case, a Bhutan lover, a Bhutan visitor who wanted to visit Bhutan, came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal signs, symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. Yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my King also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very hard. Our surveillance system that was already in place was initiated, activated overnight, and starting midnight till 7 a.m. the coming morning, that is 6th of March, we managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 7-8 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we also managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dichen's leadership, everything was planned beforehand. And then our King was also awake the whole night trying to coordinate the whole thing and bring all the primary contacts together. So we do not wish to have positive cases in any countries, but to have a positive case in this manner and to be able to identify all the primary contacts and isolate them, I thought was a huge success that we brought in. Then starting from there, we managed to treat him, take care of him very, very well, and his family wanted the patient back home. So he was successfully air evacuated day before yesterday, and he reached his hometown last night actually. So we wish him a speedy recovery. All the people of Bhutan send our sincere prayers for his speedy recovery. But the fact is, since as we all know and as all the heads of the country shared here, this is our uphill task because we really don't see our enemy. This pandemic that is challenging all of us do not follow geographical boundaries. That's why, as I said, it's very important for all of us to be on the same page. And as we all know that it affects the elderly people and it affects more people with comorbid conditions. So similarly, the aftermath of this disease will also affect the smaller and vulnerable economies more hardly than the better ones. So we are equally concerned that as we fight and as we try to contain this disease, we are also concerned about the economic outcomes of this disease. So therefore, I would like to support all the proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in time and with the changes of the demand of this pandemic, we also come and regroup ourselves. And I also would like to propose that we must have a similar cooperation in economic get up on this issue, because all the smaller economies are disproportionately hit. So with this, I'm sure my other colleagues will have a lot of points to share, and I also would like to contribute as the discussion goes on. So as of now, I would like to thank all the heads of the states and heads of the countries, governments, as well as Prime Minister Modi for your initiative. Thank you very much.
Thank you, Excellency. I call upon Her Excellency Prime Minister Sheikh Hasina to share her thoughts.
Thank you very much, Prime Minister. And well, thanks again for convening this meeting. This initiative should not end here. It should continue through our officials, also our health experts. They can work together and they can continue the discussion how we can combat at present situation or the challenge of COVID-19 and other diseases. Let us not forget how we all are interconnected in today's world. Now, whole world is suffering, and the people. I think this is for the first time it happened. Because of this COVID-19, now people from everywhere, actually the whole world become very much worried about it. So the initiative within us, the South Asian country, it is an excellent idea, and we should find out a strategy, and I really appreciate and we welcome your ideas and initiatives. I mentioned that this SAARC official can work and they can activate all these ideas, and also our experts can join together, because I feel that we need to work together jointly in close collaboration for addressing these challenges. I feel that our joint effort, we can save our people, and also we can make progress in this area. So I feel that your proposals, we can, our experts can sit together and we can, examine that how we can implement it and we can make progress. So I thank you very much for this initiative, and I hope that together we will be able to combat this distress situation. I look forward to being in touch with you all, Excellencies, as required, and hopefully together we can ensure the safety, security of our people in this region. And again, I thank you very much, and our new SAARC Secretary General can coordinate the follow-up actions, which will, I feel that will be, an excellent job, and Bangladesh would be happy to join all these efforts. So again, Prime Minister Modi ji, I thank you very much for your initiative that holding these video conferences. And again, I request all our officials to continue this dialogue, which is very, very important at this moment for our peoples of South Asia. Thank you very much.
Thank you. Thank you, Excellency. I now request His Excellency Prime Minister Oli to make his remarks.
Thank you, Excellency Narendra Modi ji, the Prime Minister of India. Our region is at high risk of COVID-19. The epidemic knows no boundary, no nationality, and no region. Therefore, we need to devise ways to combat this pandemic collectively. It is a common challenge and it demands common efforts. First thing is awareness creation. Community-based organizations and medical and non-medical volunteers could be mobilized in raising awareness and supporting government agencies. We have to appeal to our people to avoid non-essential foreign travels and to avoid attending mass gatherings and other large-scale events. Our region is rich in traditional medicine. We have to encourage our people to use this asset for the prevention and treatment of this disease. Our way of greeting people with namaste rather than shaking hands can avoid potential threat of women-to-women transmission of this virus. I believe that our region holds a good stock of emergency medical supplies, well-trained medical professionals and laboratory facilities. These would be deployed at the call of any member state of SAARC in urgent need. The hospitals in the bordering areas could also be utilized for the screening as well as treating infected patients coming from across the border. We may encourage hospitals, medical centers, research institutions and health workers in the region to build a good network for sharing experiences, research findings and best practices in critical areas associated with the prevention and treatment of this deadly disease. We need to ensure a smooth supply of essential medicine, equipment and sanitary materials in the region. We may think of developing a SAARC-level mechanism to deal with critical health issues such as this. Establishment of a SAARC emergency medical center supported by a strong funding mechanism would be desirable. In this regard, I welcome Your Excellency Modi ji's proposal and India's contribution. Nepal will also join soon in this fund. The economic cost of this pandemic is yet to be assessed. I am sure it is going to cost all of us dearly if it is prolonged. Regional discussion on reviving our economies and supporting each other through providing easy access, establishing value chains and promoting intra-regional trade, investment, tourism and connectivity would be critically important. Thank you, Prime Minister Shri Narendra Modi ji.
Thank you. Thank you, Excellency. Now I call upon His Excellency Dr. Zafar Mirza to share his thoughts.
Thank you, Your Excellency, Prime Minister Modi, and thank you for your suggestions. I think it has been a constructive and insightful discussion that we had today, and I hope that we can keep up the momentum. And I think that it is important that in SAARC countries we give public health a chance to bring us together. Let me, as a public health person myself, say that in the context of health emergencies, we need to take a proactive approach. We should not wait for emergencies to happen and outbreaks to take place and then to start our preparations. Often, all of our health systems are undergoing reform in our countries. But what we forget in this reform process is that we also have to invest in health emergencies, preparation, response, and recovery. So if we need to take a proactive approach there, and that's what we are now doing in Pakistan. I would also like to mention that the SAARC region generally remains a least integrated region in the world. I'm stating the obvious. The last SAARC summit was held in Nepal in 2014, and our health surveillance mechanisms are fragmented, and necessary regional cooperation and coordination mechanisms are largely conspicuous by their absence. We believe that SAARC Secretariat does provide us that platform which can bring us together, and we believe that we need to use this platform as a platform for pooling of resources of all kinds, including technical expertise, national experiences, and even financing, which can be used by all the members of the SAARC region. Your Excellencies, I would also like to mention that we hope that during this COVID emergency, our member countries will provide access to emergency assistance to all our regions in our countries, because equity in health is a fundamental principle of public health. In this regard, let me say that it is a matter of concern that COVID-19 has been reported from Indian-occupied Jammu and Kashmir. And in view of the health emergency, it is imperative that all lockdown in the disputed territory must be lifted immediately. Opening up communications and movement would facilitate dissemination of information, allow distribution of medical supplies, and enable containment and relief efforts to proceed unimpeded. Lastly, I would like to also address the point that His Excellency President Ghani made, and we understand his concern about the border crossings and their closure. I want to reassure him that we have done this for temporarily so that we can reinforce our point of entries and land crossings, and this is exactly in the light of the WHO guidelines and the steps being implemented by regional states to contain the spread of the virus. This is a temporary measure. I assure you, Pakistan remains cognizant of Afghanistan's needs and requirements, and I assure you that the essential supplies, including food and medicine, will be allowed through as the requisite surveillance and screening mechanisms are put in place. I thank you very much.
Excellencies, thank you once again for your time and your ideas. We have had a very productive and constructive discussion today. We all agree that evolving a common strategy is critical to handling such challenges. And we agreed to find cooperative solutions. We will share knowledge, best practices, capacities, and where possible, resources. Some partners have made specific requests, including about medicine and equipment. My team has taken careful note of this. Let me assure you that we will do our best for our neighbors. Let us ask our officials to maintain close contact and develop a common strategy in the spirit of partnership and working together. Let us identify nodal experts from each of our countries, and they can have a similar video conference 1 week from now to follow up on our discussions today. Excellencies, we have to fight this battle together and we have to win it together. Our neighborhood collaboration should be a model for the world. Let me conclude by wishing all our citizens good health and success in our united efforts to tackle this pandemic in our region. Thank you very much, and Namaste.